correspondent Nicola Hill joins us now live from London, and we are also joined by Oksana Pyzik. She is a lecturer at the University College London School of Pharmacy and also a global health advisor. Thank you to both of you, but let's start with Nicola. Nicola, tell us more about this promising vaccine.
Well, it's great to give yet more great news, Maria, isn't it? So this is the one that actually was one of the first ones to begin trials in April this year. It's announced today by Professor Andrew Pollard, who's head of the Oxford group, that it's got 70% efficacy. And what that is if you give 2 full doses, the initial dose and then a booster a few weeks later, it had 61% efficacy. They had 130 people who came down with the coronavirus. But rather bizarrely, and those are the words that Professor Pollard used himself this morning, if you gave a half dose and then you gave a full dose, the efficacy went up to 90%. Which of course is about the same figures as we've got with the Moderna and with the Pfizer-BioNTech vaccines. Now, I was listening to a press briefing this morning given by Professor Pollard, by AstraZeneca and the rest of the Oxford team. It was great. You saw a whole bunch of smiling faces on Zoom. Everyone's delirious, really happy about this. They've been working 24/7 and they gave us a bit more details about it. Now, first of all, they did say that they need to start investigating why this half dose and then a full dose was much more effective. And Professor Pollard said that might be because the half dose was priming the immune system and the booster then gave it a better immune response. And he said that they've already started work today to investigate why that's the case and whether that's what they're going to go ahead with in the future. The other good news they had was it prevented any numbers of severe cases or anybody being hospitalised with the Covid-19, and they know from the results that they published just last week that it certainly produces as an effective immune response in the elderly as it does in the younger population, which of course is vitally important because of course we know that it's the older people who are more vulnerable to Covid-19 and normally have a much weaker immune system. So these were just some of the pieces of information that he was giving us. As you say, it's great because it's a cheaper and it's an easier to manoeuvre vaccine. So it's something that we're going to find out more. What's going to be the paradigm? Is it going to be a half dose and a full dose, or is it going to be 2 full doses? And one other point that he did highlight was it seemed to prevent asymptomatic transmission. And this is important because, of course, often people are catching the coronavirus because they're coming into contact with people who've got no symptoms whatsoever. And so that's something, again, it's this transmission of the virus by the asymptomatic person is something that we need to deal with to prevent the virus spreading worldwide, even, continuing to spread.
Nicola, thank you very much indeed. When we spoke on Friday, I said we'd be speaking about more good news, and indeed we've started the week like that. All right, we continue. Let's speak now to Oksana Pyzik, who is a lecturer at the UCL School of Pharmacy and global health advisor. Oksana, your reaction to this news?
I think this is fantastic news. Out of the 210 candidate vaccines that are currently in development in different phases, to have 3 front runners here that are really going to be ready rather soon, pending, of course, final regulatory checks. This means that we are in a better position to vaccinate the world and, of course, people with different requirements. So right at the very beginning, when we entered this discussion about what will these immunization programs look like, we said that there's going to be different types of vaccines that may be appropriate for different types of, again, depending on geographical areas, as well as vulnerability, frontline workers, etc. But this does mean that there is light at the end of the tunnel. And of course, currently, we should also be very aware of that the vaccine won't affect in the UK. Here we have the second wave. In the US, they're on to their third wave. That vaccine won't affect how the current death rates, but looking forward, it does project a very positive picture in terms of protecting public health and ensuring that we can reopen societies.
And Oksana, how would you compare these 3 front runners?
So if we look at Pfizer, BioNTech, as well as the Moderna, these are both novel, new vaccines. There are no other vaccines in the world that have this type of technology, the mRNA, the messenger RNA. So that's very exciting. And it's also, because of the manufacturing process, very quick to create large amounts of doses. However, if we think about the cold chain requirements for the Pfizer vaccine at minus 70 to 80 degrees Celsius, this is going to be challenging for large parts of the world. The existing infrastructure really isn't there. If you go to pharmacies, clinics, et cetera, they have vaccine storage, but not at such low temperatures. So it will be expensive to scale that up. And in some regions already where there is a frail pharmaceutical supply chain, where regulatory capacity may be a little bit weaker, that this could present a real barrier. If we move on to the Moderna, we've got slightly better in terms of the cold chain requirements, minus 20. But the great news about the AstraZeneca one is that we can keep it in fridge temperature, and there's more flexibility alongside, of course, the cost. Now, AstraZeneca made a no-profit model here. They've worked with multilateral organizations, the WHO, as well as other governments, to ensure that there's going to be equitable access to the vaccine. So very low cost means that there's going to be able to get it to many more places in the world. So again, that's excellent news. And it also means that with this two-dose scheme, where it's a half a dose plus a full dose later, we're talking 90% efficacy. This is excellent coverage. Remember that the FDA had said they would accept emergency authorization for any vaccine that was over 50% effective. So if we look at this comparatively, there are different points we need to consider, but price is going to be one of them, as well as looking at the supply chain and how we're going to get it to many other people in the world, in tropical climates, as well as in the Northern Hemisphere.
So many things to consider, but thank you so much for weighing in on this very promising vaccine news. Oksana, Pyzik, thank you.